I think in most medical fields, nothing has really evolved that much. It's just like an improvement of a model before, a bit like the iPhone 6 to the iPhone 5. But there are probably two big things I can think of in the field of ophthalmology, which are completely different from what we've had before. Now, just to a little bit of background, in the eye, we have the eye is very much like a camera. So there's a lens of the camera, if we like, and then there's the film of the camera, and the film of the camera is called the retina. Now, if we think of the retina as Singapore, the very important part or the soft spot, if we like, is called the macula. So that's like the Orchard Road of Singapore. And this is the part that's very important for seeing things in front of you. So if you're reading or driving a car, that's what we call central vision. Now, over the age of 65, 1 in 3 people suffer from something called macular degeneration. Now, this is something many people have accepted over the years, that so I've grown old, this is what I'm going to get, and if I lose my sight, it's just life. Don't live too long. Yeah. But in the last 10 years, there has been a new treatment. And what it does is it combats this disease. And many people have heralded it as like the penicillin, because it's something that not just stabilizes the vision, it can actually regain what they've lost. So this is what we call a anti-ANTI, VEGF, VEGF. So it's a vasoendothelial growth factor, and this is injected into the eye. So this is something that I think is very special that has happened in the last decade. The second one, which is closer to my heart, is the implantable contact lens. So in the past, in the last 20 years, people have always associated vision correction, in other words, not having to wear glasses, with LASIK. But actually, at the same time that LASIK had been introduced, there was also something called the implantable contact lens. But LASIK was very much better marketed, and the word LASIK just kinds of like just slips off your tongue. It's like Viagra. People paid a lot of money to get the name Viagra. It rolls off your tongue. Yeah. So what has been happening in the last 4 years since I've come back is that I've created much more of a public awareness of this implantable contact lens. And why I think it's so cool is because it's a product that is customized to each and every eye, and it's reversible. So in other words, say if you are 20, and you need glasses to see far, you could have LASIK or you could have the implantable contact lens. But at 20, oftentimes you don't know the right questions to ask, and it's actually the job of the doctor to tell you what could happen in the future. And I will promise you that every one of us, when we hit the age of about 45, 50, we would need reading glasses. Now, but this 20-year-old does not know to ask, what am I going to do when I reach 50? And I don't want to wear reading glasses because it will make me look old. Yeah? So with the implantable contact lens, because it's reversible, it means that I can just remove the lens when this person's 50. So basically she's had it for 30, 40 years of her life. And then we slip in a multifocal lens, which means she can see for far and for near. While LASIK is a procedure where it's more of a change, a permanent change of the curvature of the cornea. So that's not something that is reversible.